Good morning. Now, continuation of the bronchial asthma and COPD. There is the mast cell stabilizer, sodium chromoglycates. It is a synthesized chromodiuretics which inhibits uh, degranulations of the mast cell by the trigger stimulation release of the mediators of asthma like histamine. Now its pharmacokinetics SOD sodium chromoglycates is not absorbed orally. It is administered as an aerosol through metered dose inhaler delivering 1 mg per dose. Now uses bronchial asthma sodium chromoglycate is a long-term prophylactic and mild to moderate asthma and decrease in the frequency and severity of attack is more likely to exercise and exercise induced asthma. Now allergic rhinitis chromoglycate is not a nasal decongestion but regular 4 times daily use as a nasal spray produce some sympathetic improvement in many patients after 4 to 6 weeks. Allergic uh, conjunctivitis regular use as eye drops is benefit in some chronic cases. Here the adverse effect because of poor aqueous solubility absorption of the chromoglycolate is negligible. Systemic toxicity is minimum and bronchospasm, throat irritant and cough occurs. And ketolifan it is a antihistaminic H1 which some chromoglycates like action and stimulation of the immunogenic and inflammatory cells and mediator release are reduced and it is not bronchodilator produce sedation. Now its adverse effects generally well tolerated sedation and dry mouth are common. Other side effect is dizziness, nausea and weight gain. Its dose 1 to 2 mg BD, children 0.5 mg BD. Now corticosteroids are not bronchodilator. They benefits by the reduced bronchial hyperreactivity and mucosal edema and by the suppressing inflammatory response to AG/AB reaction of other trigger stimuli. The realization that asthma is primarily an inflammatory disorder which if not controlled essentially with time and the availability of the inhalation steroids that produce few adverse effects has led to early introduction and more extensive use of the glucocorticoids in asthma. Now, systemic steroid therapy. This therapy is restored to the asthma under the following two situations. First is severe chronic asthma not controlled by the bronchodilators and inhaled steroids or when there are frequent recurrent of the increasing severity. Starts with the prednisolone. Here the status asthmatic acute asthma exacerbations, asthma attacks not responding in the intensive bronchodilators therapy start with a high dose of the rapidly acting. Here the COPD, a short course of oral corticosteroid may benefit some patients of the COPD during an exacerbation. Inhaled steroid. These are corticosteroids with high topical and low systemic activity, and beclomethasone and dipropionate budesonide and fluticasone have similar properties, and corticosomide is a later addition because airway inflammation is present in early mild disease as well as and bronchial remodeling starts developing from the beginning. It is being advocated that inhale steroids should be the step and one for the asthma patient. Here the COPD, the airway inflammation in the COPD is not very responsive to the corticosteroid as such. Only high dose inhalation steroid and beneficial in the advanced COPD with frequent exacerbations should not be used in the early mild in case. Adverse effect: hoarseness of voice, dyspnea, short throat, asymptomatic or symptomatic oropharyngeal candidiasis, and then most common side effects. These can be minimized by the use of a space gargling after every dose and prevented as well as treated by topical nystatin and clorimazole. This is no uh, ad- advance of the mucosal damage of the increased incidence of the chest infection, and systemic effects of the long-term inhalation glucocorticoids are clinically relevant only in the dose more less than 60 microgram per day. Now beclomethasone dipropionate, the intranasal spray is effective in the patient's rhinitis. There is a list of the drug for the given as a inhalations. Now budesonide, a non-halogenated glucocorticoid with a high topical systemic activity ratio, and its give effect of first pass metabolism for the beclomethasone. Small function that is absorbed in the rapidly metabolized, less systemic effects. Fluticasone propionate. This inhaled glucocorticoid has high potency, longer duration, and negligible oral bioavailability. The dose swallowed after inhalation that little propensity or produce systemic effect. Now, flunisodile, this topical steroid is available for the prophylaxis and treatment of the seasonal and perennial rhinitis. Cyclisonide, this inhalation steroid utilize a novel approach to the improve topical system activity ratio. Now, anti-IgE antibody, amylase, it is the inhaled asthmatic medication for classes of the anti-asthma drug. Wise B2 agonist, anticholinergic, chromoglycate, and the glucocorticoids are available for the inhalation use, and they are aimed to deliver the drug to the site of action so that lower dose is needed and systemic side effects are minimized. Here the aerosols are two types. Use a drug in the solution. Pressurized method does inhalation. A nebulizer. Use drug as a dry powder, spinhair, and rotahaler. Here the choice of the treatment. The severity of the asthma symptoms ranges from the uh, transient respiratory difficulty to the incapacitating breathlessness and characteristically fluctuates over time. A stepwise guideline to the treatment of asthma as per needs of the patient has been recommended. Mild episode asthma, inhaled short-acting beta-2 agonist and onset of each episode. Uh, Seasonal asthma, start regular low dose inhaled steroid or uh, glycate 3 to 4 weeks before anticipated season's attacks. Here the mild chronic asthma with the occasional exacerbation. Here the regular low dose inhaled steroid. Um, Moderate asthma with the frequent exacerbations, increasing dose of the inhalation steroid, inhaled long acting beta 2 agonist. And severe asthma, regular high dose inhaled steroid. Here means its dose is 800 to 200 microgram per day. Now the status asthmatic or refractory asthma. Any patients of the asthma has two potential to develop acute to severe asthma has been the potent to the develop acute severity of the asthma. And here the hydro cortisones hemisuccinate 100 mg is given to the patient, and second is nebulized salbutamol plus ipratropium bromide, and third is a high flow humidified oxygen inhalation, and four is salbutamol 0.4 mg IM or SC may be added since inhaled drug may not reach smaller bronchi due to the severe narrowing of the plugging with the secretion. And incubation and the mechanical ventilation, and treatment chest infection with the intensive antibiotic therapy, and correct dehydration and acidosis with the saline plus sodium bicarbonate located infusion is given to the patient.